Aging Life Care Moment. In 1985, the Aging Life Care Association was founded by a handful of intrepid women. However, since those early days, the number of male geriatric care managers, aging life care managers, has been increasing. As part of the Aging Life Care Association's efforts around diversity and inclusion, and during the month of June as Men's Health Awareness Month, we will feature male members to hear how they got started in this career and how we can bring more gender diversity and awareness to the career. Today, we are talking with Spencer Brown, an aging life care professional at Accountable Aging Care Management and ALCA's South Central Chapter President. Spencer, welcome, and tell us, how did you get started? How long have you been practicing care management?
Thank you, Courtney. I have always had an understanding, a basic understanding of the profession. I was in long-term care, managing nursing homes and assisted living communities, a predominantly female-driven business as well. And I began my career in aging life care management about 11 years ago in 2010 during a career transition. So I've been in with Accountable Aging for 11 years.
That's great. And I love hearing how you sort of transitioned from the long-term care. Tell us, when did you join ALCA and what's been your journey inside the association and working with the association?
Well, when I joined Accountable Aging, I was aware that there was a national association. So I joined immediately within 30 days, became a member. And then it took me a couple of years to get the professional work experience before I could sit for the certification exam to be a certified aging life care professional. So I've been a member of Aging Life Care Association for that long too, and have slowly increased my involvement over those years.
And did you get involved at the chapter level, in different roles or committees leading up to your chapter presidency?
I did. I actually had a fellow colleague who suggested that I get involved at the chapter level, and I began attending some chapter meetings and getting more involved. And then I was nominated to serve on our chapter board, which I served probably for 4 or 6 years total in 2 different positions, getting the inner workings of it, getting to go to a couple of national conferences and chapter conferences before I was nominated a few years ago as chapter president. So it was a progression for sure.
And you mentioned that the career has been predominantly women. What do you think that the association and the industry can do to help show this as a viable career for other male aging life care professionals?
Yeah, well, as I said in my introduction, in terms of my previous career, a female, say, dominated field, I've learned that there are a lot of men that work as social workers and nurses that work in hospital settings, medical offices, and I encounter them all the time. And I think one of the things that ALCA can do is reach out to some of those settings, environments where we know there are men working and thinking about a career in aging life care. I think those would be the places to hit, because there really are a lot more men than we realize in the medical field.
Yeah, great ideas, great suggestion. Well, thank you, Spencer, for your time this morning. We really appreciate it.
My pleasure. It's a pleasure to be part of the Aging Life Care Association.